Any public comment today that is not on our agenda? Any public comment today? Yes, when you come forward, please state your name and address and keep it to 3 minutes or less. Thank you.
My name is William Zablocki. I'm 1115 Mill Street. Yeah, thanks for allowing me back. I came here last month and I was concerned about the policies that were going on in the school system, and I appreciate the comments and feedback that you guys gave during the meeting. It definitely helps with letting the community know that you're listening, which is one of our huge issues. I'm actually here today kind of on a continuance of that, but more in what I would phrase to be your yard and not their yard. I've seen, obviously I've been immersed in a lot of this information that's going around about the COVID-19 measures. And so last month, the health department issued an emergency order requiring kids to be quarantined if they're in close contact to positive cases. There are a couple things that stand out to me about that. One that should be concerning to everybody is that they're quarantining asymptomatic kids. If in fact you don't know if you have the infection beforehand, so that's why they're quarantining them. You've already missed the point to control the spread at that point. And so then the other things that I've been seeing that are more concerning is what I think that leads to is I think that the health department is essentially subverting due process for these children. There's no indication that they were infected other than just simply being present near someone who is positive, and then they're sent home and quarantined for 10 days. Now, I've seen actual courts in Michigan uphold injunctions against that order. It is akin to house arrest for these children that have done nothing to deserve to be removed from school for 10 days. I would argue that the physicians in our community would lead you to believe that the virtual learning program last year was detrimental to their health. And I think that this takes it a step further by taking kids and putting them into a place where there's no remote learning opportunity and they're not even sick. And it's happening to a lot of kids. They like to blow up the close contact numbers in the schools. And so my request to this board would be to just see if you can consult with your legal routes or anyone that you have that might be able to find out if the health department is in fact breaking the law by quarantining unsick children. And that's what I came to say, and I thank you for your time.
Thank you for coming. Thanks, Bill. Any other public comment? Yes, please. Same thing, name and address, 3 minutes.
Thank you very much. My name is Mindy Cox, address 3113 Walden Woods Drive. I kind of wanted to also reference what Will just talked about, but kind of a little addition to that emergency order that was placed last Friday from the health department of our county. In the final paragraph in that order, it does state that if you are in violation of this order, that you will be fined and or imprisoned up to 6 months. That to me, I read the fine print of the entire order, seems extremely concerning and excessive. And just wanted to bring that to your attention that and it's almost like how the order is written. If kids, now that the vaccine will most likely be available to these underage children, how the order is written kind of makes it sound like if you choose not to vaccinate your child against COVID-19, there will be repercussions in the order, such as they will have to do the 10-day isolation quarantine, or they will be mandated to do the testing, but vaccinated children will not. And currently they don't have to either. Currently, if you're vaccinated, the teenagers in the middle schools and high schools, they do not have to be quarantined. It's suggested that they do the testing, but it's not required, but it is required if you're unvaccinated. And so that's why it's concerning, just because this is still under an EUA, or it will be still under an EUA, an emergency use authorization. The long-term studies are not completed yet on this. And to me as a parent, that is concerning. I wanted to kind of address this also. If it was such a state of emergency, why are we not in the county? Why is the health department not requiring everyone, adults included, to be masked at our places of employment and testing? We are only making these measures on our least vulnerable population, which we all know the kids are the least at risk. But this is the order. In October, when we came, our group came to this last meeting, we were shown support by several commissioners, and we appreciate that. The MPS superintendent and health director continue to enforce their unsubstantiated mask mandate on K through 6, which may soon turn into a vaccine mandate. If you watched last week's school board meeting at the school board, our own elected officials give over all decision-making to the superintendent, who wrongfully deems himself the sole decision maker on our students' behalf and their medical matters. As your mission states, the mission of the Midland County Board of Commissioners is to perform their legally constituted county government responsibilities, which are to protect the health, welfare, and safety of the residents of our community and our employees. We are here to ask you commissioners to step up and use your leadership to protect the 7,000 students of Midland Public Schools and their families. The unilateral decision-making and override of parents' medical decisions is absurd. It interrupts student learning and families' ability to be at work to support their families. It sacrifices our students' mental well-being and social development. And we would just love your support and thank you for all you've done so far.
Thank you for coming. Thank you for your input. Is there any other public comment today? Seeing no public.
Wait.
We have one more? Yes, please. Please come forward, state your name and address in 3 minutes or less.
Good morning. My name is Jill Booth. My address is 1111 East Pine River Road, Midland, Homer Township. I was also at the school board meeting last week, and there were some great presentations. But mainly regarding this public health order, it's an order, which is, in my interpretation, it's not law. But it has that section 12 where pursuant to some state law, whoever violates a regulation of a local health department can be imprisoned for not more than 6 months or a fine of not more than $200 or both. This town has been founded by leaders in the chemical industry, and it couldn't have been done without really evaluating the science. And I am suggesting that this health order is based on CDC guidelines and not traditional science. For instance, there is no measures of early treatment for COVID. In this town, you can't get early treatment for COVID. For instance, my husband was exposed a couple weeks ago. So we isolated. And in talking with his doctor's office, he was not eligible for monoclonal antibodies because he's not 65 or older. So monoclonal antibodies is the only thing Midland offers. I think it's horrible. Nobody can get ivermectin, which is not just a horse dewormer. Nobody can get hydroxychloroquine. These measures have been proven to be essential to preventing hospitalizations and death. So there's a couple of our federal senators that are in the federal government, well, Senator Ron Johnson, Senator Rand Paul, who are fighting against this whole CDC narrative. And if you are supporting our public health, I encourage you to investigate people that are proposing to expose what's available for early treatments. So I did have a copy today at 10 o'clock. Ron Johnson is holding an expert panel on COVID, vaccines, entries, and federal mandates, which mandates, as you know, are going to cause a tremendous loss of critical workers, staff, airline staff, and law enforcement staff. So with your permission, I would like to hand you out this copy of this article so you can tune back in at 10 o'clock and see what the other side of CDC is.
Thank you very much. We'll pass those out and thank you for your comments.
Thank you.
Thanks, Jill.
Is there any other public comment? Yes, oh, please. Name and address in 3 minutes, please.
Renita Bonadies, 1191 East Phillips Court. I would just like to say that I've been attending the school board meetings for 4 straight months now. And the problem I'm having, just one of them, with the school board, we send emails to them. We ask for their responses. They sit in meetings. They tell us they're going to respond, but not during the meeting. We're not getting feedback, and when we do, it's not anything of any value. It's not substantive. And 2 months ago in September, they brought in their own expert panel of 4 doctors to address the community and the parents that were present. Those doctors that came had one agenda, and there was only one agenda, and that was support the mask mandates, encourage vaccines as being safe and effective, would not acknowledge even the VAERS database, which if any of you are familiar with, explains how deadly this virus is. And yet the school board and the superintendent only brought those 4 doctors in to tell the public what we had to do and why. And when anything to the contrary of the current public narrative was expressed, it was referred to by one of their expert doctors as you guys are involved with clickbait. So they brought in experts that are totally unwilling to acknowledge other people in their profession. And as this commission and other people in this community are doing, there is science on the other side of this argument that is refusing to be publicly acknowledged. It's not being enforced. We're allowing our school boards to sit here and dictate based on one side of a science project. And there is another whole science that says what they're doing is abusing our kids. They are doing things contrary to the health, mental health. They claim there was absolutely no research that would indicate that these masks are having a negative impact on our students. And we all know that's a lie. Our students are suffering, suicide rates are up. Nobody wants to talk about those aspects. We just want to talk about if we can mandate this and make this tyrannical government exist for our poor children. And I don't have kids in the district, but I have grandchildren, and I just say, I don't understand how leaders can sit back and allow these doctors to be brought up from one side of an argument and tell all of us we have to listen to only their side and anything else is false. Thank you.
Thank you for your comments. Is there any other public comment?